Now, COVID-19 deaths in Ghana is now 66 following the passing of 8 patients as of June 15. 4 out of the 8 new deaths are in their 30s. 6 of the cases are from the Ashanti region, with 2 from the Greater Accra region. We have details of the mortalities on your screen. We have 397 new cases that have been recorded. The active cases now stands at 8,114 and recoveries at 4,410. And if you look on your screens, we have a 59-year-old female who died with comorbidity of diabetes in the Ashanti region. We also have one who was 69, a male, also dying with diabetes and hypertension. And then we have one with sickle cell as well, 62-year-old female, also dying there. There's one with hypertension, and also there are 2 others who have no comorbidities at all. They were not showing symptoms at all, but died of COVID-19. That is the latest as far as the death toll is concerned. We also have those who are critically ill and in severe condition, 4 and 2 on ventilators. We have 5 at the UGMC, 3 at the Ga East. In terms of the severe cases, Kolebu has 3. We also have Konfanoche with 2, 1 in Ho, 1 at the police hospital. So 13 severe cases and 4 critical with 2 on ventilators. And of course, our new cases now 397, bringing us to in excess of 12,500. Of course, the total case count now is 12,590. That is the situation as far as COVID-19 is concerned in the country. Meanwhile, a 3-month-old baby among the COVID-19 deaths recorded in the northern region. The baby was referred to the Tamale Teaching Hospital, according to health officials. The 2 others are a 24-year-old woman who was also referred from Bolga to the Tamale Teaching Hospital, and an 80-year-old woman who died about 2 months ago. The northern region now has a total of 52 COVID-19 cases with 32 recoveries. The region's active cases are 17 with no critical cases. Now, speaking at a briefing in Tamale, the Northern Regional Director of Health Service, Dr. John Beston Eliza, said all active cases are being managed at home.
As we speak, we now have accumulated cases of 52 COVID-19 cases. We've had a total of 3 deaths. We have 32 recoveries. We've not had any critical case. And as we speak, we have 17 active cases, all being managed at home. Let me quickly add as the details of the deaths. The 3 deaths. One is the 80-year-old lady who died somewhere in May and at the Central Hospital. Just last week, we had 2 additional deaths. A 24-year-old lady who was actually referred from Bolga in the Upper East to TTH. She spent just 6 hours, an hour on arrival, and then passed. But because of the era in which we are, the high index of suspicion made the staff to take a sample, and the sample came out later as being positive. The 3rd death was a 3-month-old baby who was referred from Savlugu Hospital and came in very breathless and this and that. Again, sample was taken, and he also didn't last that. He virtually died on the arrival, almost died on arrival, and so the sample was taken before that, and it also turned out to be positive for COVID.
Now, Dr. Beth Sewa is an adjunct assistant professor of medicine at the Nebraska Medical Center in the U.S. She joins us via Zoom for some analysis on this very sad story there, madam. We told about the 3-year-old baby losing her life, losing the fight against COVID-19. Our death toll and the demographics is becoming a major concern. What do you make of the situation from where you sit as an expert?
Thank you for having me on your program, and good evening to your audience. I think that once you start having death in babies and this degree of spread, with what I can observe from afar to be about 300 cases almost on a daily basis, it is a pointer to the extent of community spread that we have right now. And it means that certain measures must be enforced or put into place. I know that some have said, you know, maybe we're testing more and that's why we're finding more cases. But here's the analogy I like to make. It's a very simple one that if you take a very rich person and they don't tell you they're rich, let's say they have 12 bank accounts. The fact that you are discovering their bank accounts does not make them rich. They were rich because they already had the bank account. So let's take the accounts to be cases. So if we say that we're finding the cases because, and that's what's accounting for our numbers, that's not exactly accurate, because if somebody has nothing in their bank accounts, you can find 1,000 of them and you will still have nothing. So in reality, we're actually finding these cases because there are more. And there's essentially about 3 things we need to do. One is the personal protection and distancing and putting on of masks. And we need to continue to find the cases and isolate them, because the less we find the cases, the more the asymptomatic people will be spreading to others. And of course, we have to continue our public health measures like churches not being open, schools being closed. But it looks like at this point, that is rather the new phase we are entering into. And places like China, where in Beijing, they're now enforcing some lockdowns, tell us that we need to rethink whether some places really need to go on lockdown.
And do you agree with those who are already saying that perhaps we should call that already? We should have some form of localized lockdowns because of the increasing cases we are seeing in some parts of the region, especially the Ashanti, the northern regions, like we're seeing now in Beijing, where, you know, some parts of the city is going, or the province is going under lockdown.
Yeah, absolutely. That is what we need to do, especially if we can identify the hotspots, because Beijing actually, as of this morning, they only had 106 cases in that market, but to them 106 is way too much, and so they're enforcing lockdown and doing what they can because they cannot afford another epicenter. So that is the attitude we ought to have. And like I've always said in the past, with COVID-19, you have to overreact to actually be on time. In other words, you have to be proactive instead of reactive. At this point, we're in a reactive mode. It means we're waiting till we have a lot of cases before we ask, okay, oops, what do we do? Rather, we should be proactive and determine that, you know what, in a month or 2, this is what we're going to have. And so these are the measures we need to put in place.
Now, I want us to look at the issue of treatment. In the northern region, all active cases, we are told, are being treated from home, despite the rising death toll and also the evidence that suggests that people who are in the treatment centers recover quickly and respond to treatment as compared to those at home. Will this strategy work for us?
Yes, in a lot of situations, that is what it has to be, because at this point, we know that a lot of our cases do not have severe symptoms. If there was a magic wand that will let you know which patients will progress to that severe case, then we could do that. So unfortunately, some people would have to be nursed at home, but then there has to be good communication, because from day 8 to 10, those who would get really ill develop what we call the cytokine storm. And sometimes it happens rapidly within hours and they can die. So the magic would be being able to communicate with these people who are at home so that we can pick out the ones who would go on to develop the severe illness that will require hospitalization, because it might not be practical to keep all these patients in the hospital. And I think that's what is happening in some of our hospitals in Greater Accra, where they're complaining, or even in Kumasi, Kompanochi, where we're complaining that the treatment centers are getting full. So
Absolutely.
if people are not severely ill, it's okay for them to go home, so long as we know the home condition is such that they're not going to spread more disease to the people at home.
And I guess that is where the challenge is. Meanwhile, 97 health officials in the Ashanti region alone have been infected. As of Friday, when I spoke to the GMA, the national figure was 70. In the Ashanti region today, we are being told that 97. I mean, what should we be doing as far as the treatment and the protection of our healthcare workers, the front line, is concerned, so we can avert a crisis situation at the hospitals?
As of this morning, I was hearing that some of the Nigerian doctors have laid down their tools, saying they need personal protective equipment. And so we need to make sure that these healthcare workers have all that they need to take care of themselves. And from what I've seen, it looks like Ghana is doing a fairly good job in terms of the kind of outfit that the healthcare workers put on to take care of the infected patients. And so these need to be available. And secondly, we need to re-educate some people. Maybe people have forgotten the protocols they need to put in place. And then the other thing too is, as of a few weeks ago, a lot of the healthcare workers who had fallen ill were not those in the treatment centers, because they know the procedures, they know what to do. So we need to educate all healthcare workers, even in clinics that we're not sure they will be exposed to COVID-19, because if we're hitting 13,000 cases, it means a lot of patients will present in settings where we don't even expect them to have COVID-19, but they may be exposing the healthcare workers.
And just a quick one on that in just 1 minute, because we're running out of time on this interview. On testing, should we be doing mass testing now, targeting, even if it's in phases? Should we be doing that?
Yeah, I understood that that's what we're doing in addition to the enhanced contact tracing and testing. My understanding was that we were doing mass testing, and I could be wrong.
We're actually not doing that, but I want to thank you very much for your time here on JoyNews Prime. That's Dr. Bertha Sewai with the Nebraska Medical Center in the U.S. She is an adjunct professor of medicine. Thank you very much for your time. Now.